Hey all, welcome to ShareTreck. This is Raj here, friends. It's a weekend and I'm taking it easy these days on the weekend, so you don't see too many of my videos. But this video is very interesting. I came across a new class of antibodies called as nanobodies, and its story is amazing. This goes back to 1993 in Belgium, where scientists used camel blood to study antibodies because they didn't have another category of blood. That's at least the way I understand the story right now. And they discovered something amazing. Apart from the regular antibodies that we see in all mammals, they also found lighter antibodies in the camel blood, and they were intrigued. So they did studies about it and they got it patented. And at this point of time, there is at least one FDA approved therapy using nanobodies. So today's video is going to talk all about nanobodies, and it will also tell you how it stacks up against monoclonal antibody and broadly neutralizing antibodies, the two classes of antibodies that we are familiar with. So without further delay, let's get started. Welcome back, friends. Nanobodies, also known as single domain antibodies, are a novel class of therapeutic proteins derived from camelid antibodies. Camelid antibodies are antibodies derived from camel blood. Unlike conventional antibodies, which are composed of two heavy chains and two light chains, nanobodies consist of a single monomeric variable antibody domain. They are much smaller than traditional antibodies, allowing them to access and bind to unique epitopes that are often inaccessible to larger antibodies because they cannot squeeze into the areas where those epitopes are present. And nanobody, or NB with a capital N, is a artificially designed antibody molecule, also known as single domain antibody, or small case SD, capital case A, and small case B. So it is SDAB, or single domain antibody, VVH antibody, or camelid antibody. These are all the various names by which it is referred. In 1993, Belgian scientists discovered a heavy chain antibody, HCAB, in a camel serum sample that was naturally deficient in light chains and had a much lighter molecular weight. As you can see in this figure, the structure included two constant regions, CH2 and CH3, a hinge region, and a variable heavy chain domain, or VHH. From this, a single domain antibody containing only a VHH domain was obtained. The crystal structure of VHH antibody is an oval-shaped nanobody, which is only 1/10 of conventional antibodies in size and weight, making it the smallest intact antigen binding fragment. Hence the term nanobody was derived. Several biotechnology companies have recognized the potential of nanobodies and have been actively developing them for various therapeutic applications. Here are some of the prominent ones. As you can see in this table, we have a subsidiary of Sanofi, Ablynx, which is working in nanobody development. And this subsidiary was acquired by Sanofi in 2018. Then we have Merck and Company, which has access to nanobody technology through acquisition of Pandion Therapeutics for autoimmune diseases. And then we have Amgen, which is exploring nanobodies through collaborations including with Ablynx, and Genentech, which is a part of the Roche group, engaged in research and licensing deals related to nanobody technology. And then we have Crescendo Biologics, specializing in human bodies, focusing on oncology and immunology. So this is the lay of the land when it comes to companies that are already using nanobodies. Next, I want to talk about how successful it has been in real world. One of the most notable FDA approvals for a nanobody-based drug is Cablivi, developed by Ablynx. As you can see in this table out here, it is for a condition called ATTP. I'm not going to try to pronounce this long scientific name. I've always had trouble with that. It's the first approved nanobody therapeutics for approved by FDA. The FDA approval for this therapy was received in February 2019. And apart from that, there are a few of them in clinical trials. Nanobodies are being investigated in various stages of clinical trials for a range of indications. And I would say that if you look at the last three rows in this table, you will find that they are targeting RSV, which is again a topical target at this point of time. Again, Sanofi is involved in this. It's in clinical trial. And then a collaboration between Ablynx and Sanofi is looking at rheumatoid arthritis and inflammatory diseases using nanobodies. It's also on clinical trial. And of course, Crescendo Biologics is working on some oncology targets. It's in preclinical trials, so it will take a little bit of time before it can get into clinical trials. So hopefully they succeed out there. This gives you an idea of the real world application of nanobodies. And the main takeaway here is that nanobodies represent a promising frontier in biopharmaceuticals, offering unique advantages due to their small size, stability, and specificity with ongoing research and development. And several companies are actively exploring their potential across various therapeutical areas, with some notable success already achieved, such as the FDA approval of Cablivi. And the future of nanobody-based therapies looks bright, with many more candidates in the pipeline aiming to address unmet medical needs. For context, I'm going to show you another table that shows how nanobodies fit with BnAB and monoclonal antibodies. So this will give you a comparison. So let me queue up the chart for you. As you can see in this table, broadly neutralizing antibodies and monoclonal antibodies are all critical components of modern therapeutic strategies. Each type has a unique characteristic that makes it suitable for specific applications. Some advantages of nanobodies are their small size, which is like approximately 15 kilodaltons, which allows for better tissue penetration and ability to target less accessible epitopes, including those inside cells. Also, nanobodies are highly stable under extreme conditions such as high temperatures and pH variations, which is beneficial for storage and administration. They can also be produced in microbial systems, making production cost-effective and scalable. And they are ideal for targeting unique and small epitopes, as well as intracellular targets, which are difficult for larger antibodies to access because they can't squeeze into crevices. So if you look at the comparison between nanobodies, broadly neutralizing antibodies, and monoclonal antibodies, there is an order of magnitude difference in size and weight. Nanobodies are 1/10 the size and weight of BnABs and monoclonal antibodies. And they have a high level of tissue penetrations, whereas broadly neutralizing antibodies and monoclonal antibodies have moderate penetration of the tissue. And in terms of stability, there's a very high degree of stability for nanobodies, and their binding affinity is also quite high, similar to BnABs and monoclonal antibodies, and specificity is also equally high and absolutely comparable to BnABs and monoclonal antibodies. The cost, however, of manufacturing nanobodies is relatively low compared to the higher cost of making BnABs and monoclonal antibodies. And as I mentioned earlier, when you compare how BnABs is used and monoclonal antibodies is used for various applications, nanobodies are used for targeting less accessible epitopes and intracellular targets, whereas BnABs are used for broad spectrum viral infections, and these are for highly mutating viruses such as HIV. And then you have monoclonal antibodies, which are used for a wide range, including targeting cancer, autoimmune diseases, and infectious diseases. So overall, this is the comparison of nanobodies with the current toolkit that we have of BnABs and MABs. So we are indeed living in a very interesting time when it comes to genomics. Even though in the share market you don't find too much of excitement or movement, and most of the genomic shares are languishing, I think medicine is changing in its nature. Instead of addressing a host of symptoms to treat a disease, what is happening now is we are going to the root causes, and we are trying to address things at a molecular level, and that is very interesting. And the nanobody, I don't think impacts the profitability or future prospects of any of the genomic companies that we have in our watch list. But I suspect that nanobodies are going to help us better address any new pandemic that may come, because it will be one more tool in our toolkit to create vaccines. That's my personal opinion. And so that's what I wanted to bring across to you. This is a very interesting time ahead, and we have to watch companies like Sanofi and see how they take nanobodies and progress it further. So with that, my friends, I'd like to bring this video to an end. I hope you enjoyed this. Thanks and have a great day. Bye for now.